Yes, sir.
Okay, so let me
Yes, sir.
start recording. Okay, so today we are going to discuss the blood gas analyzer. Okay, and this is the final topic that I am going to discuss. And then there is one more topic which is audiometry, and I will share the PPT. You can go through it. Okay, so but this is the last topic that I am going to discuss with you. Okay, so if there is any problem with my audio, please let me know. Okay, so what the blood gas analyzer is going to do. Okay, so blood gas analyzer, it may do something, right? So what it is going to do, so the first thing that it is going to do is it is going to measure the pH, partial pressure of carbon dioxide, which is called as the PCO2, and partial pressure of oxygen, which is called as an PO2. Okay, so this particular blood gas analyzer is going to measure pH, PCO2, and PO2 of body fluids. Okay, so we are having different body fluids. So this particular blood gas analyzer is going to measure these three parameters. So the blood gas analyzer will be capable of measuring these three parameters. That means the pH, concentration of hydrogen ions. Okay, and then the partial pressure of carbon dioxide, which is called as the PCO2, and partial pressure of oxygen, which is called as an PO2 in your body's fluids. And in that, the blood will be taken as the reference. Okay, human blood will be taken as the reference there. Okay. So why there is a need for measuring all these three parameters? Okay, so there is some need, right? Then if there is no need, there is we are not going to measure that. Okay, so for measuring these three parameters, the major need for measuring these three parameters is they are going to determine the acid base balance in the body. Okay, so they are going to determine the acid base balance, because your body is going to have some acids and base, and there should be a balance between the acid and base. Otherwise, what happens? Okay, let us see what happens if there is a change in the pH. Okay, where is my concern? If there is a change in the pH, or there is a change in the PCO2, then it may lead to cardiac arrhythmias or hypotension, or it may even lead to death of the person. Okay, so you have to remember that the pH and PCO2 should be maintained in a balanced way in your body. Okay, and it is very important. Okay, so that means the acid base balance in the body is a very important parameter, and this can be measured by measuring these three parameters. We can know that the acid base concentration in our body. Okay, and who are going to maintain this acid base concentration? Okay, who are going to maintain this acid base balance in the body? Okay, the kidney and the respiratory system. Okay, because the acidic and basic will be managed by the kidney, and the PO2 and PCO2, that means partial pressure of carbon dioxide or partial pressure of oxygen, will be maintained by your respiratory system. Okay, that means if there is any problem with your kidney or with your respiration system, then it may affect your acid base balance in your body. Okay, and there may be some chemical buffers. Okay, if you are taking if you're taking blood or any tissue fluids, so there will be a chemical buffer. Okay, and that buffer is also going to minimize the change in the hydrogen ions, because the hydrogen ions are going to be affect your pH value, right? So the chemical buffers which are present in your fluids are going to control your hydrogen ions. Okay, so this is the interaction part. Okay, that means the blood gas analyzer will measure pH, PCO2, and PO2 in your body fluids. And then why it is needed? It is needed to know the acid base balance. Okay, if the pH and PCO2 are not get changed suddenly, then it may lead to cardiac arrhythms or even death of the person. And who is going to maintain this particular acid base balance? The kidney and the respiratory system is going to play the important role in maintaining this acid base balance in your body. Okay, and there will be some chemical buffers which are also going to minimize the change in the hydrogen ions in your body, so that the pH will be maintained constant. Okay, so let us see what is blood pH measurement. So have you understood the previous slide?
Yes, sir.
Okay, so let us see what is a blood pH measurement. Okay, so it is nothing but, as you know from the physics or chemistry, you had already learned that the pH is nothing but it is a concentration of hydrogen ions, right? The pH is nothing but a concentration of hydrogen ions, and this particular concentration of hydrogen ions is going to determine whether the solution is acidic or alkalic, or you can call it as a base. Okay, so is the solution, that means the body fluid here in the biomedical application, in place of solution you can take the body fluid. Okay, so the concentration of hydrogen ions will represent whether the body fluid is an acidic or alkalic in nature. Okay, if there is increase in the hydrogen ions concentration, then the solution will become acidic, and if there is a decrease in the hydrogen ion concentration, then the solution will become alkalic or base. Okay, and this is the formula for pH, that means negative log of hydrogen ions, H plus. Okay, so have you understood the blood pH measurement? Have you understood this? Okay,
Yes, sir.
let me move the other slide. Okay, so the why what how the blood pH is measured. Okay, and that means here I have said that pH will be the concentration of hydrogen ions, right? So if you take in the blood, okay, if we take the pH of the blood, so it is one of the very tightly regulated parameter in our human body. Okay, that means if you take the pH of the blood, then you can see that it is very tightly regulated, that it just varies between 7.35 to 7.45. So it is not going to get below 7.35, or it is not going to increase more than 7.45. So it is very tightly regulated between 7.35 to 7.45. Okay, so this is about the blood pH, and the change in the pH will be regulated by negative feedback mechanism which is present in our body, which is called as hemostasis, which will be, I think you may discuss, you may get this word in your anatomy and physiology or in somewhere. Okay, and then what are the importance of blood pH measurement? Okay, so yeah, from here you can know that it is very tightly regulated, and the change in pH is regulated by hemostasis, which is a negative feedback mechanism. Okay, so what is the importance of measuring this blood pH? As I said in the initial slide, that we are going to measure pH, PCO2 and PO2, right? pH, partial pressure of carbon dioxide, and partial pressure of oxygen using in the blood gas analysis, right? So what is the need? Why we need to measure the blood pH? Okay, if there is any acid base disorders, or if you want to diagnose the cancer or renal failures. Renal means kidney, the renal cells are nothing but the cells that are present in your kidney. Okay, so if there is the acid base disorders or the cancer or the renal failures, then for diagnosing those particular problems you need to measure the blood pH. Okay, and for diagnosing the patient in the ICU also, if the patient is kept in ICU, then also the blood pH will be monitored there. Okay, and if the doctors are performing an open heart surgery, so in that condition also there is a need for measuring the blood pH measurement. Okay, and uh, if you had inserted a drug into a patient, you have a patient and you have inserted a drug into the patient, and if you now know, if you want to know the effect of the drug on this human or in this on this patient, then at that time also the blood pH will be a very important parameter which will show you the effect of the drug on the patient. Okay, so these are the four important reasons why we need to measure the blood pH. Okay, the first one is if the person is having acid base disorders or cancer or renal failures, then we can get diagnosis or we can know the severity of that particular problem by using the blood pH measurement. Okay, and if a patient is kept in a ICU, then also the blood pH measurement will be one of the important parameter. Okay, and if you are performing any open heart surgery, OHS, then also the blood pH measurement will be an important parameter there. And then effect of drug on a patient, if any patient is given a drug for diagnosing, if you want to know the effect of the drug, then also the blood pH measurement will be a very important parameter here. Okay, so have you understood this particular importance of blood pH measurement?
Yes, sir.
So let us move to the next, that is how we are going to measure the pH. Okay, so we can measure the pH by using the gas electrodes or metal oxide electrodes or fiber optic pH sensors, in which there will be a pH sensor which is directly going to measure the pH. Okay, so in this we will discuss the first one, that is glass electrodes here. Okay, so let us see. Okay, so this the glass electrode is just working on a basic principle that we are going to develop an EMF between the electrode that is measuring the pH and the reference electrode. Okay, that means you are going to have one reference electrode and one electrode which is in contact with the blood, and there will be a EMF developed between these two. The electrode that is used for measuring the blood and the electrode that is used reference. So the EMF between these two are directly going to represent the pH in the blood. Okay. So here the important thing that you need to do is you just need to know the construction here. Okay. So what is the advantage? This method is very accurate, and but the disadvantage is this will be a time consuming. Big. Okay, because why the glass electrodes is time consuming? Because first we need to collect the blood, and then we have to put the blood in a pH analyzer, so it will take some time. Okay, it is because it is an in vitro analysis, because here we need to take the blood out from the body and then we have to measure it outside the body, so it will take some time. Just the disadvantage in this is it is a time consuming process. Okay, but it is a very accurate method. Okay, so let us see. Okay, so if you see that glass electrode based devices, there may be present in a different shapes for measuring the blood pH. Okay, it will not be a single shape. There may be different shapes. I will discuss one shape with you, and there may be different shapes for measuring the blood pH. The most common type is syringe electrode. Okay, the syringe type of electrode is most preferred. Okay, in this, why it is most preferred? Because it is going to take very small sample of blood and perform the analyzing within the syringe itself. So you are going to take the blood out into the syringe itself, and the blood analysis is also done inside the syringe itself. Okay, so that's why the syringe electrode is most preferably used. Microcapillary electrodes require very small quantity of blood for analysis, and if you take the microcapillary glass electrodes, so they require a very small quantity of blood analysis. Okay, um, and as they require a blood of about 20 to 25 microliters. Okay, this much of amount of blood they require in this glass electrode. So it will be very useful for that. Okay, so you have to just remember here is there will be several types, but in that most preferably the syringe electrode is used, because you can take the blood into the syringe and the measurement can be done inside the syringe. That means once taking the blood, there is no need to again remove the blood out into some other place. You can do the complete measurement inside the blood itself. Okay, and microcapillary electrodes, the advantage with that is they require a very small quantity of blood, that is up to 20 to 25 microliters. So if there is a need for measuring the pH continuously, like when doing the surgery, so we can continuously take the 25 ml of 25 microliters of blood from the capillary and we can do the measurement. Okay, so let us see the construction here. So you can see on the right side here, are you able to see the image here?
Yes, sir.
Okay, so the image that I have round off, this is the glass electrode pH measurement device. Okay, so this complete electrode is enclosed in a water jacket. Okay, and the surrounding you can hear it, there will be water flowing. Okay, so the complete electrode will be enclosed in a water jacket, and the water will be circulating, and the temperature of that will be maintained as 38 degrees centigrade. Okay, and the water which is circulating in the surrounding will be NaCl, that means the salt water. Okay, sorry, NaCl, sorry, not so it will be NaCl. Okay, which is acting as a shielding, because why we are using 1% of NaCl. First thing is this particular electrode on the enclosed in a water jacket, and that particular water jacket is going to have the circulating water at a temperature of 37 degrees centigrade. Okay, and that particular circulating water will contain 1% of NaCl. Why? For making them against the static interference that is coming outside the environment. Okay, so This is the inside construction. So here there will be a small catheter. This is going to take the blood out from the capillary. Okay. And then this will be there will be a solution. This will be the KCl solution, and one electrode will be inserted in this, and this will be your reference electrode, and this will be your glass electrode. That this particular big one has been shown as a small one here. Let me erase this. This particular big one has been shown here as a small one. Okay, so first what you will do, you will take this electrode and you will this is a syringe type. Okay, you can press it here, and this particular small catheter will take the blood from the patient. Okay, you will take the blood inside, and then you will keep the syringe in this solution. Okay, this is a KCl solution, and there will be already one electrode in the solution. That will be the reference electrode, and this will be the sample electrode. So from that, here you are going from here and here, if you measure the voltage, there may be some EMF. Okay, and this EMF will directly represent the pH of the blood that has been taken into this particular glass electrode. Okay, don't get confused. This and this will be same. What we are going to do is, first we are going to take this glass electrode, and we are syringe type electrode, and we are going to collect the blood by using this particular small catheter. So the blood will come into this catheter, and then the same syringe is going to be dipped in this KCl solution. This KCl solution is already having a reference electrode, and this is your catheter. So the difference between these two will be, you are going to get the EMF. Okay, and this EMF will directly represent the pH here. Okay, have you understood this?
Yes, sir.
Okay. Then if you see the pH of the blood, as I said that the pH of the blood is very tightly regulated, 37.35 to 7.45, like I said, where I said like this here, 7.35 to 7.45. Okay, but the small variation, that means 7.35 to 7.45, the variation because of the temperature. That means the temperature get varied at a range of 18 to 38 degrees centigrade, so there will be variation, right? That is the reason why I have said that this particular complete electrode will be enclosed in a water jacket, and particular water jacket is going to have a temperature of 38 degrees centigrade. Why we are using a water jacket and why we are circulating the water at 38 degrees centigrade? Because this electrode is intended to measure the pH, right? And if the temperature of the electrode get varied, so the pH of the blood which we had collected is going to get varied here itself. So you are not going to get the exact value there, right? So that's the reason why this complete electrode has been enclosed in a water jacket, and the temperature of the water jacket has been maintained at 38 degrees centigrade, because the blood is going to have an upper limit of 38 degrees centigrade, and we are maintaining the 38 degrees centigrade constant. So the pH that we are getting collected into this electrode is not going to get varied, and then we will then insert this in a solution, and then when measured, so value that you are getting will be a perfect accurate value, because the blood that we have collected is not going to be affected by temperature, because the electrode has a constant temperature. Okay, तो समझ में आया क्यों वाटर जैकेट यूज किए हैं? इलेक्ट्रोड के सराउंडिंग में वाटर जैकेट क्यों इसके समझ में आया?
Yes, sir.
Okay, so this is about the pH measurement. So now let us move to the other measurement that we do in the blood gas analysis, that is blood PCO2, partial pressure of carbon dioxide. Okay, so this is also one of the important parameters that we need to measure, and how we are going to measure it. Okay, so the PCO2 is nothing but a partial pressure of carbon dioxide gas. That means the CO2 gas that get dissolved in the blood, because the gas will be dissolved in the blood, right? When the gas reaches reaches the tissue, so at the tissue, the blood will give the oxygen out and takes the carbon dioxide in. So this particular CO2 will get dissolved in the blood. Okay, so how much amount of PCO2, what the partial pressure of PCO2 will reflect the exchange of this gas through the lungs. Okay, once the blood is having the PCO2, so the blood will again go to the lungs, and at the lungs the CO2 in the blood will go out of the body through the lungs, right? So if there is any variation in the PCO2, so it will directly represent that your gas exchange out from lungs to outside air, he is having some problem, and it will directly represent the effectiveness of your alveoli, right? You know that in the lungs there will be a smallest unit known as alveoli, where the carbon dioxide in the blood will go into the alveoli and the oxygen in the alveoli will get into the blood, right? So if the carbon dioxide in the blood is having some change, that means the PCO2 in the blood is having some change. That means the gas exchange at the lung level is having some issue. That means the alveoli is not effective here. So it will directly represent the effectiveness of lung alveoli. Okay. And then it is a very good indicator of respiratory function. Okay, so the PCO2 will represent a very good representation of respiratory function, and as I said that it will affect the acid base hemostasis. Okay, so what are the factors that are going to impact the PCO2? So what are the factors that are affecting the PCO2 means? First one is the hyperventilation. That means if you are placed in such an area where the ventilation is very less, then the CO2 level will become very low. And if you hold the hyperventilation, right, that means if there is more ventilation, then the CO2 will get reduced. And if you hold the breath for a longer time, then your CO2 levels will get increased. Okay, that means these are the manual things. Hyperventilation, that means if you are taking the air more, okay, then you are taking the oxygen more. So what happens in your blood, the oxygen PO2 will be more and PCO2 will get reduced. Okay, or if you want to reduce your PCO2, what you will do, if you hold the breath for 10 to 15 seconds, then the oxygen will become less and CO2 will become more. Okay, so these are the two things that you do manually. And how the physiologically the CO2 will get affected, if there is any pulmonary edema, that means any problem in your lungs, or if you are having any asthmatic attacks, that means if your person is having an asthmatic problem, then this may lead to change in the PCO2 value in the blood. Okay, so this is about the interaction part of your blood. Okay, let me explain this also. Okay, so let me erase this. So what you are measuring the PCO2, and what is the PCO2? It is the carbon dioxide gas dissolved in your body. If there is any change in the carbon dioxide, that means you know, right? From the blood, the air comes into alveoli, and from the alveoli, the carbon dioxide goes out, right? If the carbon dioxide in the blood having change, that means the PCO2 is having some change. That means your lungs are not effectively taking the carbon dioxide out to the environment, or your alveoli are not effectively taking the blood CO2 from the blood. Okay, so this will likely represent the respiratory function and the acid base hermatosis. And the factors that affect the PCO2 is, if you manually take more air, then oxygen will increase and automatically PCO2 will reduce. Or if you hold the breath for the more time, then the CO2 will become increased. These are the two things you can do manually for increasing or decreasing the PCO2. And the other thing that you need to do is physiologically. That means if you are having any pulmonary edema or acute asthmatic attack, then it may lead to PCO2 increase. Okay. So have you understood the interaction part of PCO2?
Yes, sir.
Okay, so let us move into the device, that is how it is going to operate. Okay, this is just based upon the fact that this all the CO2 will change the pH. Okay, if the CO2 in the blood will be taken into a certain material, so the pH of that particular fluid will get varied. Okay, so here we are just taking the CO2 from the blood, and we are and if the CO2 comes into a particular solution like H2CO3 here. Okay, so what happens if the CO2 comes into the H2CO3, then this particular H2CO3 get dissolved into H plus and HCO3 ions. So when it get dissolved into H plus, then what happens? Automatically the pH will get increased because the hydrogen concentration is getting increased here. Okay. So that's it. That's the happening in the device also. The CO2 from the blood diffuses through the membrane to form HCO2. Okay, so there will be a membrane. Okay, we are going to take the blood. So what happens? This particular membrane will only allow the CO2 in the blood, and it will not allow any other gas. So the CO2 from the blood crosses the membrane and enters into my solution. And in the solution, what happens? This particular H2CO3 will get dissolved into H plus and HCO3 minus. Okay, so as you know that when the H plus, that means the concentration of H plus get increased, then automatically the pH will get increased. So directly the pH increase is directly representing the PCO2 change in your body, right? So this is a series that is getting happened in your meter. Okay, so let us see here. Okay, so the solution that we are the solution that we are taking here is NaHCO3. Okay, NaHCO3 solution will be taken, and a thin Teflon membrane will be taken in this particular device. Okay, so you can see a membrane here. So this is a thin Teflon membrane on the right side. Are you able to see the image on the right side?
Yes, sir.
Okay, so here you are having a thin Teflon membrane, and here you are having the NaHCO3 solution, and here you are having a pH and then here you are having a pH sensitive glass. Okay, so what happens? So when you insert this particular electrode in the blood, and then when you collect the blood, so the blood will be collected, and in the blood there will be CO2, right? So only the CO2 in the blood will be allowed by this membrane here. Let me erase this. Okay, the CO2 in the blood, this is my blood I had collected. The CO2 in the blood will be allowed by this membrane, and the CO2 enters here, and this membrane will not allow anything, oxygen and anything other gas in the blood. It will not be allowed, only the CO2 will be allowed. And here I am having NaHCO3, right? So when the carbon dioxide comes into this NaHCO3, so this HCO3 will get divided into H plus ion and HCO3 minus ion. So you are getting the H plus ion. That means the hydrogen concentration increase. That means there will be increase in the pH. So this pH increase will be detected by this device. So, and it is calibrated in such a way that if the pH increase, so the pH is directly representing the PCO2. So in this way, if the device will directly represent the PCO2, that means the pH change will be characterized as an PCO2 here. Okay, so have you understood the operation of this device?
Yes, sir.
So let us move to the last topic in the blood gas analyzer, that means measurement of blood PO2. So I have already said that we are going to measure pH, which we had completed. We are going to measure PCO2, which we had completed. Now we need to measure PO2. So how we are going to measure the PO2? Okay, so before measuring the PO2, so let us discuss what the PO2 indicate here. Okay, if there is a change in oxygen in your blood, that means it definitely represents the gas exchange at the lung and the blood level, because the blood is coming to the lungs, and in the lungs, from the lungs the oxygen will get inserted into the blood. So that means if there is any change in the oxygen in the blood, so it is nothing but there is some problem with the lungs and oxygen exchange. Okay, and ability of the blood to adequately perfuse the blood tissues with oxygen. Okay, and one reason will be here. That means the oxygen from the blood, lungs is not effectively going into the blood, and the other reason is, let us consider here, if everything is nice, so the blood is taking the oxygen and coming to the tissue. So at the tissue level, what the blood will do, the oxygen in the blood will go to the tissue. So, okay, that means the blood here, the blood is not adequately giving the oxygen to the body tissues. Okay, so these are the two reasons if there is any change in the PO2. One reason will be from the lungs, the oxygen is not getting into the blood, or other reason is from the blood, the oxygen is not going into the body tissues. If from the lungs, if the oxygen is not getting into the blood properly, then the PO2 will be less, and from the blood, if the oxygen is not going into the tissues properly, then the PO2 will be more. So that's it. So it will definitely represent the effectiveness of the here. Okay, it is measured by using polarographic electrode. So here for measuring the PO2, we are going to use the polarographic electrode. So this particular electrode is going to consist of a platinum cathode and silver chloride anode. So, okay, so you are having a cathode and anode. So the cathode will be platinum and the anode will be silver chloride anode. Okay, and the membrane that you are having here will be polypropylene membrane. So like here in the PCO2 we are having a Teflon membrane, right, which is going to allow only CO2 from the blood. Similarly here we are having a polypropylene membrane which is going to allow only oxygen from the blood. Okay. So let us see what is going to happen, the elevated PO2 levels associated. Okay, if there is, what are the reasons that increase the PO2 levels in the body? So if you are increased oxygen levels in inhaled air, if you are inhaling the air and if the inhaled air is having the more oxygen, then the PO2 will increase. All polycythemine. So you have to see what is the meaning of this polycythemine. Okay, and what is the reason for decreased PO2 level? Decreased PO2 level in the oxygen will be decreased oxygen level in the inhaled air. You are inhaling the air and that particular inhaled air is having the oxygen level less, then your PO2 will get reduced. Or you are having an anemia, or if you are having a heart decomposition, or if you are having a chronic obstructive pulmonary disease, or if you are having a restrictive pulmonary disease, or if you are having a hypoventilation, that means you are in such a place where you are not having a proper ventilation there. Okay. So this may be the reason for decrease in PO2 and this may be the reason for increase in PO2. Okay. So have you understood the previous one? Because this will be the last slide, I think.
Yes, sir.
Okay. So now let us see how this device is going to operate. Okay. So the so here you are having a propylene membrane, okay, and here you are having the blood. Okay, so from the blood, what happens? The oxygen will enter here. So when the oxygen enters, so here you are having a platinum cathode. Okay, so oxygen will enter here and the platinum cathode. So at the cathode, your reaction will be like this. Okay, so O2 plus 2H2O plus 4 electrons will become 4 OH. Okay, that means at the cathode level, when the oxygen from the cathode, when the oxygen from the membrane reaches the cathode, so here 4 electrons will be emitted out. Okay, so after that, the 4 electrons will move, and it reaches the anode. Okay, and at the anode level, you know that the anode will be a silver chloride anode. Okay, so what happens? So if at the anode, the silver will be added with the 4 electrons. Okay. So, so that means at the anode, this particular 4 electrons emitted from the silver will directly represent the PO2 level here. Okay. So this is just like a circuit, and the circuit is getting completed at the anode. Okay, how it is getting completed there? When the oxygen diffuses from the membrane, so it will go and reach the here. Okay. That means first at the initially when the oxygen diffuses here at the cathode, what happens? The oxygen get added and 4 OH ions will get formed there. Okay, and then what happens at the cathode level, at the anode level? So at the anode you are having a silver, so this silver will get divided into silver plus 4 electrons. What means the silver is going to emit 4 electrons there. So this particular 4 electrons is directly going to represent the PO2. If the electrons are more, that means PO2 is more. If the electrons emitted will be less, that means PO2 is less. Okay, that is the reason why we have used the silver there. Okay. Okay. So this is happening there. Okay, so at the cathode, at the cathode also electrons is going to emitted, at the anode also electron is going to emitted, and these particular electrons are representing the PO2. Okay, let me explain this, or you may get confused here. Okay, so what happens at the cathode? You know that the oxygen from the blood diffuses through the membrane and reaches the cathode. Okay, so at the cathode what happens? So the oxygen plus 2H2O plus 4 electrons, this mix will gather and they will, that means the 4 OH minus, because the cathode that you are having here will be a platinum cathode, right? So 4 electrons will get added here, and this happens because of the oxygen that entered from the blood, and the anode level, the silver is going to emit 2 electrons. That means here at the cathode, the electron flow is there, and at the anode, there will be electron flow. That means there will be electron flow in the circuit, and the electrons will start flowing between the cathode and anode. So this particular electron flow, or the flow of electrons, is known as the current, right? So this particular electron flow is called as resultant current here. Okay, and this particular resultant current will represent the partial pressure of oxygen there. Okay, so have you understood this?
Yes, sir.
समझ में आ गया? So what is the advantage of this unit? Okay, so this is very small size, so it is very small, and the current produced due to POT is linearly related to oxygen. Begin the current here, the current that is producing at the cathode or at the anode are directly representing the PO2, and the electrode is very small enough to measure the oxygen because it's very small, and the response time when you do the blood, immediately it is going to, immediately the electrons are going to emit it, and immediately according to the electron emitter, that means according to the current, you are going to get the PO2 value. So it is very, response time is very low, so the measurement will take only seconds. Within seconds the measurement will get done. Okay, smaller in size, and the current is directly representing the PO2, and the electrode size is very small, so that you can measure the PO2 level at any localized area. And when you give the oxygen, immediately electron flow will happen. That means immediately resultant current will come, and immediately you will get the measurement in seconds here. Okay, so this will be the calibration curve. So as the current increases, so this is the linear curve. You can see current, that means according this is the oxygen tension, and this is the ampere. So how much of according to the oxygen, the current is increasing. So it is a linear curve. Okay, there is no need for any major calibrations. It is very linear. You just have to multiply with a factor. So this is the curve. So if this much of oxygen is produced, this much of current will be produced. So you are going to get a curve linearly like this. Okay, so have you understood?
Yes, sir.
Yes, sir.
So this is about the blood gas analyzer here. Okay.